So I hereby call to order the meeting of our Community Relation Committee of Board of Directors of the NYC Health and Hospital for Tuesday, March 4th, 2025. I now call a motion to adopt the minutes of the January 14th, 2025 meeting.
Motion to adopt the minutes.
Dr. Katz,
Yes.
Mr. Chair,
Yes.
Anita,
Yes.
thank you. So I would like to remind all of the upcoming Board of Directors annual public meeting for fiscal year 2025. I encourage our CAB members to attend and provide testimony. These meetings will begin at 6 p.m. on the following dates and location. Okay, Manhattan, you in the house?
Yes.
For Manhattan, it's Tuesday, March 18th, 2025 at Gouverneur. For Brooklyn in the house? April 29th, Tuesday, April 29th, 2025 at South Brooklyn Health.
Welcome, everybody.
Is the Bronx in the house? Tuesday, May 20th, 2025 at Jacoby Hospital. Is that wonderful Staten Island in the house?
Yes, we are.
But I have a question. Why we last? Why aren't we first?
Because you save the best for last. Tuesday, June 17th, 2025 at Seaview. So it's so important that you attend these meetings because that's how you get to know what's going on in your hospitals, in your communities. I now turn the meeting over to one of my favorite doctors, Dr. Katz, for his remarks.
It's so nice to see everybody. We're working hard about making sure Bellevue is protected and has enough staff for when the Beth Israel closes, although right now the closure is again on hold by the court. I can't wait for people to meet the new CEO of Woodhull, Sandra Sneed, who has a perfect background for coming to work for us, which starts with she was born at Queens Hospital. She became an occupational therapist because she wanted to be able to help people who had been sick to get back to full function. She worked at King's Hospital. Then she got promoted and ran occupational health at King's. And she left us for some time and now is coming back. We're losing our much-loved Greg Calise, who is retiring after 9 years at Woodhull, but even more impressively, 33 years at Health and Hospitals, and we're going to miss him. We were out in Far Rockaway with the mayor to celebrate the beginning of construction of the Far Rockaway Gotham Health Center, which will be very exciting. It's in a perfect place right next to the trains so that people can easily get there. We got $10,000 of an award from the Innovation and Leadership Healthcare from MCG. We get a lot of awards, but they don't always come with money for the health system. Like if someone gave us $10,000, that's meaningful, right? Harlem was nominated as one of the best hospitals for Black America. Dr. Michelle Allen was one of the
Excellent.
Black Powers recognition list.
Excellent.
Very nice. Michelle Soto, who many of you know, who had a leadership role at South Brooklyn, now has a new appointment at Jacoby NCB, which we're very happy about. Woodhull got a new psychiatric unit, which is nice. We're at the Ida G. Israel celebration together, and I think it's really sweet that Joaquin Jeffries, despite his responsibilities as the minority leader, didn't forget his district, and he came where he's from. Like me and his sneakers, I appreciated that as well. And we got to support the opening of the beautiful new center. So that was very exciting. Thank you. Thank you for being there and for making comments. And I think that's, we have a new wellness room at Morrisania. And we do free tax prep for our patients through Metro Plus Health. And we graduated 100 peer academies to expand our behavioral health workforce. So that, Madam Chair, is my report, and always happy to see people from our community advisory boards.
Thank you, Dr. Katz. Thank you so much for always giving a great report and a lot of information, We will now hear from the 5 facilities presenting their virtual annual report. Each presenter is allotted, this is your favorite part. Ah, that's right, I don't have to say it. They're holding up their hand, that's right. Each presenter is allotted, what'd that say? 5 minutes. And we are grateful for the work that went into preparing them. Thank you in advance to all of our speakers for their time and commitment to the system. And I know that 5 minutes is definitely not enough, but you know what? You got other times to show off your stuff. But it gives us an idea of what's going on. And I wish we could go on and on because all of you have done some great stuff. So, without further ado, Bellevue.
Thank you. Thank you.
Okay, Mr. Michael Snooks, camp chair.
Well, that's a good try. We pronounce it Smook, but thank you. That's okay. Good afternoon, everyone. My name is Michael Smookas, Chair of the Community Advisory Board at New York City Health and Hospitals, Bellevue. I'm excited to share our progress and initiatives that highlight our ongoing commitment to enhancing healthcare in our vibrant Bellevue hospital community. Next slide. Oh, we've got it. Great. Equipment and infrastructure slide. This year, we've made significant investments into critical infrastructure and equipment upgrades. Our second floor therapeutic outposted unit is set to open this spring, and we have a new emergency department ambulance bay. These upgrades reflect our dedication to providing high quality, accessible care to our patients. By the way, on this slide, on the right-hand side, the upper photo appears to be from the 20s or 30s with 3 healthcare providers viewing an X-ray. The lower photo is a recent shot of providers viewing the results of high-tech radiological procedure. Next slide, please. Thank you. Patient safety and satisfaction, slide 3. Improving the environment of care is a quality and safety priority. The tools used to measure performance include surveys and after-visit summaries in the patient's preferred language. Our patient safety team is focused on meeting and surpassing the national patient safety goals as set by the Joint Commission. We have also implemented team steps training tools to help optimize patient outcomes by improving communication and teamwork skills and help create a culture of safety. Next slide, please. Thank you. Frequent complaints by patients, slide 4. Additionally, we've implemented proactive measures to address patient complaints through a committee process. The most frequent complaints include long wait times and lost property. We have implemented the tracking tools and become focused on minimizing property loss between the ED and inpatient services. Wait times in the ED are the result of many factors, including receiving transfers from other facilities and loss of services at nearby facilities. Patient advocates regularly, they're available to address patient concerns, and when necessary, they escalate issues. Plaintree International, recently we received at Bellevue with a silver certification in person-centered care. We are currently working towards recertification in 2026 and are committed to developing patient and family partnership practices, improving nursing communication, addressing and resolving complaints and grievances through the committee process and employee feedback and recognition programs. Next slide, please. Okay, very good. Issues impacting the community, slide 5. Our hospital remains vigilant in addressing healthcare disparities within our community. These challenges include opioid dependence and abuse, obesity, which results in diabetes and hypertension, maternal health issues, and the loss of service due to the closure of Mount Sinai Beth Israel. If there's a court order putting it on hold, that's good news. Thank you, Dr. Katz. We are proud that we have recognized as a U.S. News and World Report Best Hospital for Maternity Care. We hired 1,000 new nurses, and the ED is recognized as a pediatric innovator and always ready for children by the New York State Department of Health. Acknowledgements, final slide. Very good. I want to extend my heartfelt appreciation to our New York City Health and Hospitals Corporation Board and the Council of CABS. It's my second year giving this report, and it's a great pleasure, by the way. Very, very special thanks to Dr. Eric Way, who we're just getting to know. He's working very hard. Also thanks to Gladys Lowe, Chief Experience Officer, Dr. Andrew Wallach, Internal Medicine, Evelyn Hernandez in Public Affairs, and the entire Bellevue Hospital leadership cabinet for their dedication to health equity, diversity, inclusion, and accessibility. By the way, on the right-hand side of this slide is the logo for community advisory boards with its 4 words to live by: advocate, represent, inform, and advise. Thank you very much for your time. I look forward to further discussions now and in the future on how we can work together to uplift our neighborhood's health and well-being. Thank you once again.
And thank you so much. Any questions, Mr. Chair, or comments?
No questions, just great report.
Thank you.
Katz?
No, Michael, it's just, we really appreciate how heavy the volume has been at Bellevue even before closure of Beth Israel. And it's been a huge success that we are functioning as a system with Bellevue serving as our quaternary center. But we've been so successful that we're like running out of space at Bellevue. But we appreciate, how hard everybody is working, and we keep hitting new highs of volumes that we haven't seen in, a very long time.
Can I make a response to that, please?
Please do, Michael.
Okay, but I want you to know we invited to our legislative breakfast. If this person couldn't come, but he's going to come in the fall. His name is David Oshinsky. I'm a huge fan of his book on Bellevue. He won a Pulitzer Prize for the Salk vaccine, but the Bellevue book, his biography, he's going to come in the fall. So maybe you'd all like to join us. Public Affairs and I are working on that. So I'm very excited. I've read his book several times, and it's a great read for a biography.
Thank you, Michael.
Thank you.
And thank you. Anita, you have any questions or comments?
I don't have any questions, but yes, I wanted to add my voice to the chorus of thanks for the great work.
Thank you.
And again, thank you. Now we are here from Gotham Health, Belvis, Ms. Josephine Bird, CAB Chair.
Good evening, everyone. As the chairperson of the Community Advisory Board at New York City's Health and Hospital Gotham Health, Belvis, I'm happy to share our progress and initiatives that highlight our ongoing commitment to enhancing health care in our Belvis Hospital community. Next slide. Equipment and infrastructure update. This year, we were very excited to open our wellness room for our staff at Belvis. The serene space provides a quiet retreat for employees to recharge, de-stress, and heal. We are also prioritizing a cosmetic upgrade to our imaging department, a facade renovation, and expansion of our dental services to meet the needs of the community. Patient engagement and satisfaction. Belvis is very active in the community and hosts multiple health and resource fairs throughout the year. Some of these include bi-monthly diabetes and hypertension education fairs, an annual community resource fair, screening campaigns, and partner with local schools to provide teen clinic tours and education. We have also implemented an on-site pediatric asthma community health worker for our young asthma patients. Issues impacting the community. Mental health needs continue to be a concern in our community. All patients are screened for depression at each visit, and we have introduced a comprehensive collaborative care program to assist eligible patients to access social work and other relevant interventions based on their unique requirements. Our community also needs access to healthier food options and social services. We partner with local community partners, supermarkets, farmers, and community based organizations to improve access and information. We also continue to partner with our local police precinct to conduct patrols in and around our neighborhood. Frequent complaints by patients. A frequent complaint from our patients was the need for extended hours for the radiology department. As of February 2025, we are excited to share the implementation of extended hours for our radiology department. This will improve patient access to imaging services and ensure that individuals can receive timely and essential diagnostics. The extended hours should reduce wait times and also accommodate the diverse schedules of our patients. Accomplishments. Next slide. We are extremely proud of our accomplishments last year, which include gold recognitions from the American Heart Association and American Medical Association for diabetes and hypertensive care. Belvis also received an NYC Teen Connection Lasting Partnership and Longevity Award from the Department of Health and Mental Hygiene. Acknowledgements. We would like to extend our gratitude to Belvis clinical and operational leadership for their tireless commitment to serving the healthcare needs of our neighborhoods in the Bronx, as well as our strategic partners who help to amplify the impact of our work. Just to name a few, the Bronx Borough President, the Honorable Vanessa Gibson, New York State Senator, Honorable Jose M. Serrano, New York State Assembly, the Honorable Amanda Septimo, New York City Council, the Honorable Diana Ayala, and U.S. Congress, the Honorable Richie Torres. That is my report.
Thank you so much. What a wonderful report. Any questions or comments, Mr. Chair?
Just, just to commend you on the level of work connected to working with community partners. There's many good examples there of work that you're doing, so that's great.
Dr. Katz?
No comments, but very proud of all the work that you do.
Thank you.
Anita?
No comments. I like the idea of the extension of hours, and I think that's a great area to focus on.
Yes, it is. So I was really happy to hear about the extended hours. That's so important for the radiology service. This is it's really positive. That's a good thing. I also have a question. Can you share a little bit more about the role, the community health worker for the pediatrics asthma patient? Is this working well? Is it working well?
My name is Micah. I'm from,
Is it being done? Because these were questions that I looked at and was wondering, is it being done at all, the Gotham sites?
okay, so my name is Micah. I am the CAB liaison coordinating manager at Belvis. Unfortunately, our leadership, one has had a death in the family and the other one is sick with the flu. I can answer the question if you choose to, or I can get back to you later on with an answer. It's your choice.
Yes,
You would like me to answer?
you sure can if you
Okay.
can.
So, as it's a new program, it's been about 2 months in the working. The pediatric healthcare worker comes in 2 times a week. They get referrals from the doctors. They go out to the people's houses and they help them help the parents with triggers, showing them how they have triggers and with their environment and everything else in the community. To help them ease their pain with the asthma and what they have to go through with the asthmatics with the children. It's only been 2 months. I do know it's been implemented maybe in a couple of other centers in the Bronx. I'm not sure which ones. But for us, we don't have any stats or numbers as of yet. We are looking forward to having some in the future, but right now it's working pretty well.
That's good. See, you knew more than you thought you did. See, you did a good job.
Thank you.
Thank you. Thank you. Now we know. So, Gotham Health Morrisania, Miss Leslie Harrison.
All right, good evening, everyone. As the chairperson of the Community Advisory Board at New York City Health and Hospital, Gotham Health Morrisania, I'm happy to share our progress and initiatives that highlight our ongoing commitment to enhancing healthcare in our Morrisania Hospital community. Equipment and infrastructure update. This year, we were very excited to open our wellness room for our staff at Morrisania. The serene space provides a quiet retreat for employees to recharge, distress, and heal. We also opened a new 3D mammography unit and upgraded much-needed medical equipment with with generous support from Council Member Althea Stevens. Morrisania also recently completed renovations for a dedicated space to provide behavioral health services. The renovations included new lighting and ceiling tiles and new furniture for the office spaces. Patient safety and satisfaction. Patient safety and satisfaction is a top priority for Morrisania, and we are actively addressing patient experience by focusing on reducing wait times in adult medicine, and our CAB works with the Patient Relations Department collecting patient feedback twice a month when patients leave their appointments to ensure that patients' concerns are heard. We also work closely with our CBO partners for on-site tabling to ensure that resources and information are available for our patients. Frequent complaints by patients. Common complaints from patients include needed improved access to the pharmacy and challenges surrounding and rescheduling appointments through the call center. Morrisania has hired an additional director of pharmacy to ensure adequate pharmacy coverage during normal business hours. We have a future goal to expand to weekend service. Morrisania's leadership is working with call center liaisons to directly contact Morrisania when needed. We offer our patients alternatives and encourage the use of MyChart to make appointments. Understanding our community needs. Access to healthier food options continue to be a concern in our community. We partner with local farm fresh programs and the New York Common Pantry to provide nutrition and access to healthier food choices. Our community also needs access to immigration support and legal services. We partner with New York LAG and Bronx Defenders to improve access and information. We also continue to partner with our local not-for-profits to promote better access to housing support services, substance abuse counseling, and employment services like training and job coaching. Accomplishments. We are extremely proud of our accomplishments last year, which include gold recognition from the American Heart Association and American Medical Association for Diabetes and Hypertension Care. Morrisania also received New York City Teen Connection Lasting Partnership and Longevity Award, successfully completed Article 31 OMH audit for mental health, outpatient services, and hired a new nurse practitioner to support adult primary care. Acknowledgements. We would like to extend our gratitude to Morrisania's clinical and operational leadership for their tireless commitment to serving the health care needs of our community in the Bronx, as well as our strategic partners who help to amplify the impact of our work. To name a few, Bronx Borough President, the Honorable Vanessa Gibson, New York City Councilwoman Honorable Althea Stevens, New York State Senator Honorable Jose M. Serrano, New York State Assembly Member Honorable Amanda Septimo, U.S. Congress Member the Honorable Richie Torres. So thank you.
And thank you. Thank you so
Under
much.
5.
Beautiful. I'm telling you, I'm loving y'all. I'm just loving y'all. Comments or questions, Mr. Tria?
Just on the, I guess paying attention to patient needs, patient scheduling, and extended hours in pharmacy and so on. That's I'm sure that's something that comes up often, and I'm glad to see that that's happening.
Dr. Katz?
Your report made me think more about how the cabs can help us with my chart. So when I think about my own patients, they range so widely in their use of my chart. And for people who, adopt to it, they can do so much. So some of my patients, like, they go through and they remove diagnoses, they change the medicines, they cancel their appointments, they send me, notes, and other people, clearly it's hard for them to get beyond. Then there are people in the middle who can sort of use it for, a question, but can't necessarily, do full use. And I'm wondering if in some ways we could do a better job having cab members who represent our patients using it and telling us what things we could do to make it easier. I think we've struggled with what are the best ways to teach people, again, recognizing that, some people take to it really well, and some people I think are still very frightened by the idea of it.
I'm sorry, was that a question?
Well, it was an observation, and if you had an opinion on whether you thought cabs could be helpful to us as the patient voice in trying to better figure out how to set it up, I'd be interested.
I think that with my chart, sometimes the older patients, whether your older clients, might have an issue with it. I think sometimes it can be a little daunting for them because they're used to having appointments and their things set up differently, as opposed to them now having more control of their information. For younger people, I think this is the times and what they're dealing with. I think also when it comes to Spanish speaking patients, sometimes there's an issue there. And so I think those are things that when it comes to, this is my own experience with my chart. When it comes to my chart is one of those things, either you use it or you don't. That's what my chart is. I think the more you use it, the more you like it, and the more you tell somebody else about it. But if you actually use my chart, it has a host of different things. You can reach out to your doctor. You can ask your doctor's questions. You can change your pharmacy. You can talk. There's so much that you can do with my chart, but you have to know how to use my chart, and that's the thing with that.
Thank you.
Thank you. Very good. So, South Brooklyn Health, Miss Rosanna, now I have to get this name right. DeGennaro? Oh, okay. Yes.
For some reason, I'm losing my voice. Yes, I am Roseanne DeGennaro. I'm the chair of South Brooklyn Health Community Advisory Board. Our CEO,
That's what I'm looking
Svetlana
at. It's South Brooklyn.
Lipinski, was not able to be here with us tonight, but we do have our CEO, Dr. Magenta Carr.
Okay.
I'd like to say that I'm thrilled that I'm able to share all the good things that are going on at South Brooklyn Health.
Is that right? CBO?
And also to show that we have improvements that we have to make and we want to make, so that we have excellent care for our health care for the people in our community. I guess we'll do the infrastructure and equipment. Okay, this year we are making significant investments into critical infrastructure and equipment upgrades. As part of the FEMA project, the Hamlet Pavilion is completely down and the new driveway and green space is underway. The flood wall is also anticipated to be completed this summer. The construction for our Ida G. Israel Community Health Center, as Dr. Katz said, is complete. We had a ribbon cutting ceremony, and I hope shortly, within the next couple of weeks, we will have patients in the site. Construction for our ambulatory care space in the main building will begin this summer, and the renovations to the dental practice will begin in the fall. Renovations are in progress for the Women's Health Initiative project, where services will be consolidated on one floor. It's going to be a one-stop shop, which I think is wonderful. And the renovations are also in progress at the Hematology Oncology Infusion Center. And we also completed the installation for new digital signage and wayfinding signage in the main building. Next slide, thank you. Patient safety and satisfaction. Excellent leadership is committed to improving the culture of safety among the staff. The following are milestones and achievements at South Brooklyn Health. We received the Gold Plus Award for Stroke and Silver Award at the NSEMI from the American Heart Association. We received the Lanton Award for Emergency Department Nurses from Emergency Nurses Association, one of the 3 hospitals to receive it in New York City. The gold level for National Safe Sleep from Cribs for Kids. We received the Silver Beacon Award for the sick nurses from the American Nurses Credentialing Center of Pathway to Excellence. The Gold Plus Award for Blood Pressure Control from the American Heart Association. We were a certified stroke and PCI center. We've done a total of 1,484 surgeries using the Da Vinci robot. We received an A grade from the Loan Institute for Pay Equity and Most Socially Responsible Hospital. We passed TJC triennial survey held in August 2024. The Pathology and Laboratory Department received full accreditation from the College of American Pathology in December of 24, and the Dental Department successfully completed the Commission on Dental Accreditation. Now we're going to go to, I think it's 2 more slides. The frequent complaints. Next one. Good. Thank you. The frequent complaints, communication, coordination of care, the wait time, and lost profit. Next slide. The initiatives to address the frequent complaints. Several initiatives have been implemented by the care team, patient relations, and leadership. Communication. Eye Care with Kindness and Communication Safety Skills, CSS training programs were launched in September of 24, with plans to further strengthen these efforts and improve communication skills across all teams. Over 1,000 employees completed the Eye Care training since the launch. The coordination of care, reinforcing a team approach to resolve issues in real time. Also rounding by patient representatives on the units and the ED to proactively identify and resolve any issues prior to the escalating to a grievance. Wait time, optimizing a team-based approach to tackle extended wait times for diagnostic exams and appointments by actively involving care team members to expedite scheduling or implement alternative solutions to meet patient needs efficiently. And lost property, we've designated a property storage room in our ED for patients' belongings. Issues
The same
impacting
things here,
community.
Lofty.
There were-
That you are.
First, is the
Must be
continuing
office of
crime,
financial
not only
development.
on the streets, but in the subways and also traffic, which leads us to the need for a level 1 trauma center at the hospital. It takes much too long to get to the nearest level 1 trauma center. And within that time, we lose lives. We know it, we've seen it. So we are really need, and if you hear the people in the community say they're insisting that we become a level 1 trauma center. Sorry, Dr. Katz,
That's okay. I know.
you know it and you know we need it. So now we have to figure out how we are going to get it. So I'm leaving that to those who know much better than me,
Thank you.
okay?
Thank you.
But, can I just do the acknowledgements?
Oh, I thought you, okay.
Also, thank you to Mayor Adams, the
Oh,
Brooklyn Borough
okay.
President Antonio Reynoso, all our dedicated federal, state, and city officials, the Fire Department of New York, and the the New York City Police Department, and for their continued and commitment to the health and well-being of the Southern Brooklyn communities. Thank you. That's
And
my report.
thank you. Great report. Questions, comments, Mr. Chia?
Yeah, I mean, this issue of communication comes up often in you know, across any system, not just ours. So I'm glad that you're addressing it. I mean, it reminded me of the hospitality work that is happening at one of the hospitals,
Elmhurst.
Elmhurst. So I don't know if that's something that at some point we should explore. To
Yeah.
learn more about it. But anyway, thank you.
Thank you.
Dr. Katz?
The I to G practice is just beautiful, right? It's really nice, and I hope people will go and see it because it's a really beautiful space.
Good. Thank you. Seaview. Mr. George, what, I was practicing this name now. Wodaka?
Wanaka, you got it.
Vodka. I was close,
All you
right?
have to do is think of Monica, you got a Wanaka. Very, very simple, okay? All right, well, George Marino, our chairman, asked me to speak to this board, and I'm glad to be here for the first time. Actually, this is the first time for me to do anything, so we'll have to carry on. Good evening, everybody. As the substitute chairperson for the Community Advisory Board of New York City Health and Hospital Seaview, I'm happy to share our progress and initiative that brought our ongoing commitment to enhance healthcare for our patients and residents. Slide 2, please. We have secured $2.5 million in bond funding to update our residential shower rooms and our chapel roof, which is in great need of repairs. The architect has been on site and have submitted a preliminary plan for the project. We are working with the building department and OFD to ensure the project is complete within our budget. Okay, so we're working on that. In addition, we have secured funding for a new public announcement system and a voice-over IP phone system. The wiring has begun when our television system was upgraded. We are also seeking funding for new furniture for our lobbies and new beds for our residential rooms. Patient safety and satisfaction. Slide 3. Seaview is honored to be listed as the #1 nursing home in the New York City by Newsweek magazine Best Nursing Homes list, and we're proud of that. Slide 4. Seaview continues to implement new strategies to improve the patient and residential experience. Patient safety and satisfaction remains on the top priority and is evident by our press galley satisfaction scores. They remain strong with an overall satisfaction score of 99.23. Now, a little bit of the downside. Frequent complaints by patient and resident, which is in slide 5, okay, missing clothing and room changes are on the top of the complaint list for our Seaview residents. Complaints are managed by grievance, social worker department, and personal care plans. Seaview maintains active engagement with our residential patients, families, and designated representatives to resolve number of complaints and to assist to help ensure timely resolution. Slide 6. The addition of the Assistant Community Affairs Director at Seaview has proven to be an asset to the facility by his involvement in the Seaview Volunteer Program. The program has added volunteer organizations such as American Corps Seniors, RSVP, Workforce Connect. Our list of volunteer organizations added to the well-being of our residents through friendly visits, transportation, and therapeutic recreation. Further programs including the Veterans Program, where Seaview veterans community can reconnect and We met, talks, and compare stories about their service time, and that is in effect as of now. They've already had some meetings, and it's really coming off very well. Acknowledgement on slide 4. We'd like to extend our gratitude to the Seaview CAB for their commitment to serving the needs of Seaview residents and to our elected officials for their support of Seaview. We also met with a couple of our elected representatives at our last meeting, and we invited them to come visit our project there, and they accepted, and we're going to come up with some other things to meet with them as they're going through the premises and show them what the money we're getting is doing for them, but show them that we need more money. So,
Yes, that's the key.
any questions?
Ah, Mr.
Not your
Chair,
job.
Mr. Chair.
Just impressed with the satisfaction numbers.
Don't ask too many questions.
That's good.
And I'll see you. Well, I'll see you in June, right? At the meeting. So that's it.
Dr. Katz?
It's hard to beat number one facility in the whole state. Hard to beat that.
Congratulations.
Congratulations.
Anita?
Thank you.
Yeah, I was impressed by the 99.23% patient satisfaction. Just gotta find the lost clothes. And the Newsweek ranking. Great job.
Thank you. First, let me just say to all of you, is, you know, every other month that we meet and we sit with the cabs, it's a joy just to know that our community is in safe hands at your facilities. So just keep up the good work. Keep up the good work. Thank you, Deb. This is the team, this the Make It Happen team. Afinte, Deb and her crew. You know, that's a crew. Thank you for making a lot of this possible. And of course, we can't do a lot of this without Calethea and Jenny and the team. So thank you, and always thank you, Dr. Katz,
My pleasure.
for being at the helm.
My pleasure.
We are finished at 6 o'clock.
Good job.
This meeting is no longer being recorded.